How's everybody doing from Monday? Okay.
Miss Marvel.
Yes.
So you remember last term when we talked about ADHD, I had concerns following that my daughter might had it because of the symptoms and that stuff. So she finally got her diagnosis. She has ADHD with hyperactivity and anxiety.
Oh.
I was like, I was right.
Mm-hmm.
I mean, I'm just glad that they finally found out what was going
Yeah.
on.
We talked about that last term.
Yeah.
Well, it's good that they sorted it out.
Yeah. Now I know.
Yeah. I'm just waiting for the rest of the group to get in. And we'll get started. Everybody have a nice weekend. Okay. Just waiting for a few more people.
$150. Let me tell you what, the most time I give her $150. Then I turn around and give her another 150.
Okay, I need for the rest of you to come on camera. There's about 3 of you that aren't on camera. There you are. Angelique, there you are. Kadisha.
My camera is on.
Oh, I can't see you. It's a blank screen. Pamela, I'm looking at your wall behind you. You just pull the camera down a little bit. There we go. Okay, great. I don't know what's going on, Kadisha. It's a black screen. Okay. Okay. It's 3:02, so let's get started. Since we have a couple of weeks to cover here. First of all, does anybody have any questions about anything we covered last week in the orientation with regards to attendance, with regards to late work, with regards to assignments, due dates, modules, exams, study guides, anything? Nobody has any questions? Okay.
I do.
Oh, okay. Go ahead.
So we have quiz tomorrow. That's due tomorrow, right?
No, we do the quizzes. We're going to do the quizzes at the beginning of class.
Oh, I thought it says due on the 18th.
No, I've sent out assignments. I've sent out announcements. That the 18th is the end of the week. So we do the quizzes. That's been in the announcements. Actually, I think hang on.
I couldn't attend last week's lecture. I just saw the recording
Okay.
because of the schedule changes.
Okay. As long as you watch the recording to see what you missed, that's great. As far as quizzes go, who asked that question?
Me.
Oh, okay. And you weren't here last week. If you watched the recording, you would have heard I went over the quizzes. How we're going to be doing quizzes this term, and that is at the beginning of the class of the week that we have the quiz. So for example, today is quiz 1. So as soon as we go through a couple of housekeeping items, we're going to do quiz 1. So did you get that part in the recording last week?
No, I just like review it just like a few minutes before the class start. But okay.
When were you added to the class?
I think they added me on Friday.
Okay. So you had the weekend to go through the recording, and then I sent out an announcement yesterday that talked about the quizzes. I think I put it in bold letters. The quizzes were going to be done at the beginning of class.
So we do them in the beginning of the class?
Yeah, it's because it's a key graded assessment. It has to be done in a proctored setting. So that's how we're going to be doing the quizzes. At the first 15 minutes of the class, we'll do the quiz, and then we'll go through some content. And then at the end of the class, we'll review the quiz together.
Okay.
Okay. So that's what we're going to do today. We'll go through the quiz. We'll do the quiz first, and then we'll review any questions you have from week 1 content, and then we'll cover some content from week 2. You have 2 recordings, content recordings. I sent one for last week, one for this week, which is a summary of what we're going to be covering. Okay. We'll go through that, and then we'll review the quiz. How does that sound? Good. Okay. All right, then why don't you guys all, it's 3:06, so let's go till 3:20. That's 15 minutes. Let's go through, you guys open up quiz 1 and go ahead and work on that. And then we'll start back at 3:20. And don't forget to hit submit. All right, please submit it before you come back. Or
Is it
not come-
okay if I actually do my quiz on my phone?
However, if you can, sure.
Can
Okay,
you see
all
it?
right, okay.
Do we pause and we come back?
Nope, just stay right where you are. Just pull it up on your computer and start working on it. I'm going to stay right here as well.
Okay.
You see?
Pardon me? I can't understand you. I'm sorry. You want to put that in the chat? You can put the question in the chat if you'd like, Kadisha.
Can we do it on the phone?
If you can do it on the phone and submit it, sure. Sure. Yes, I can. Kadisha, I can see you now. Yes.
Okay.
You can still see me, right? Well, I can do it on the phone.
Okay.
Okay. Uh,
So go ahead and work on quiz 1 and we'll come back in I'm going to mute myself and we'll come back in at 3:20. And don't worry about putting your names and campuses in the chat. We don't need to do that. I get recordings right after class of the attendance, so don't worry about that. Just focus on the quiz for now. Okay, we've got about 1 more minute, so please finish up. I'm not sure who 3489 Middletown is. I don't, who is that? Okay, Lashana. Okay. 3489 Middletown is Brittany Hunt. Brittany, is that right? Okay. Brittany, we're all done taking the quiz, so we took it from 3:05 to 3:20, and it's 3:20 now, so I'm sorry. Let's see, Tamu, if you could turn your camera on. Is everybody done? Lashonda,
No, I'm not. I just
Lashana,
messaged you. No
right,
problem.
yep. I saw that, that's fine. Keep working on it. Okay, Tamu, you back? There you are. Okay. Okay, has everybody submitted it? Except Lashana? No. Lani, how do you pronounce?
Lanisha.
Lanisha. Pretty name. Lanisha. Okay. Okay. We'll review that after we go through some content. Okay. So, last week, did everybody have a chance to review last week's material? Did everybody have a chance to review my content recording? Yes, no. Okay. Last week we covered, let's see. Okay, so last week we covered introduction to community nursing, levels of healthcare prevention, Healthy People 2030, and introduction to vulnerability. Okay, so I'm going to I'm going to share my screen and we're going to go to our week 1 notes. Okay. Week 1 notes. So what did we learn about community nursing as far as the intro to community nursing? There's 2 things you need to know. Okay, and this will be on your exam. Okay, what is the difference between community-oriented nursing and community-based nursing? Based on your preparation, can somebody tell me, without reading this, what's the difference between community-oriented and community-based? Because there is a significant difference that we need to be able to decipher.
Community nursing is that it's inside the community, like around.
Okay. Okay. So the big difference is community-oriented nursing, you're focused on the community or the population as a whole. Okay, you're mostly focused on health promotion rather than illness care. Okay, so you're focused on the whole group rather than the individuals. So I always remember it as you're trying to orient yourself. I'm not sure who I need to mute, but someone's not muted that has a lot of background noise. So community-oriented nursing means you're trying to get yourself wrapped around the whole community, right? You're focusing on health promotion rather than illness. Okay. Whereas community-based nursing, I think of as you're already based in the community working. You're caring for ill individuals. Okay, you may be a school nurse, you may be a home health nurse, you may be a hospice nurse, occupational nurse. Okay, so you're providing illness care to certain members of the community versus health promotion, health maintenance that you'd be doing in community-oriented nursing. Do you guys understand that? You need to know the difference between those two. Public health is the big umbrella, okay? Part of community-oriented nursing is public health. Okay? Part of what we do most of what we do in the community is primary and secondary prevention. So let's skip to levels of prevention. What do you guys know about the levels of prevention? Have you studied this in other classes? Or is this the first time you've heard about primary, secondary, and tertiary?
I think we learned it in med-surg.
Okay, you've talked about this in med-surg. So what can you tell me? What's the difference between primary, secondary, and tertiary?
Primary.
Primary,
Oh, go ahead.
no, I was just gonna say primary is prevention, secondary is a screening, and tertiary is like treating the disease.
Perfect. Perfect. Kadisha, perfect. Thank you. Does everybody understand that? And has everybody been introduced to those terms? So one of the things we're going to talk about weekly is our levels of prevention. Okay. So taking what Kadisha just said, we need to be able to apply primary, secondary, and tertiary interventions to each topic we're going to cover. Okay. So for example, primary prevention is going to look different when we're working with hospice patients versus workplace injuries, right? Secondary so my point is that there are different interventions with each of these depending on the topic we're talking about. So like Kadisha said, primary is prevention. We want to try and prevent something before it ever happens. So in general, what would be some primary prevention? What would be some primary prevention strategies?
Vaccines.
Vaccines, good.
Safety.
Immunizations,
Immunizations, good.
wearing your seatbelt.
Yep.
Like when you're in a car or riding a helmet if you're riding a motorcycle or something like that.
Yep. Yep. We're trying to prevent something, any kind of illness or injury before it even happens.
Would it be
Okay.
like also like checking a blood sugar? Would that be preventative just like for high blood pressure and stuff like that?
Yeah, if you haven't identified that person to be at risk and you're just doing a general screening, sure. But once you start to check blood sugar and blood pressures, you're starting to get into the secondary, which is screening. Okay. I always think of secondary as early identification, early intervention. Okay, so for example, let's say you have my 20 years of experience in community health is in the schools. So for example, let's say we screened kids for BMI, right? And we found that there was a significant group that was at risk for obesity. That's secondary screening, early identification. We want to identify our students at risk. So if we can early detect that they're at risk, we can attempt to try and work with this group to prevent complications, to try and reverse the course before it becomes tertiary. Does that make sense? So early identification, early treatment, early intervention. And there are several primary, secondary, tertiary questions on all the exams, at least a half a dozen on each exam. So we have to understand the difference. So then what's tertiary? Tertiary is management, the treatment of something. So what do you have to consider it a tertiary intervention?
A disease,
The diagnosis,
A diagnosis, a condition, a disease, an illness. Okay, so when you're looking at questions on exams about identify a tertiary level of intervention, you have got to make sure that you search for an answer where somebody already has something wrong, right? Like mental illness or substance abuse or diabetes or had a stroke or whatever. They have to have something. Okay, so at this level, we're trying to manage whatever they have, maybe reducing symptoms, trying to improve quality of life. Right, so for a diabetic, maybe we're monitoring the way they do their blood sugars, maybe we're making sure they have the right equipment, their insulin's not expired, they have access to insulin, they already have diabetes. Okay, so whenever there's already a diagnosis or disease or complication in place, you know that's going to be tertiary. Okay. What we mostly do, well, we do all three in community nursing, primary, secondary, and tertiary. But one of our biggest jobs in community nursing is education. Okay. And I don't want you to get tripped up thinking education is only at the primary level, right? We educate people to prevent something from happening. Okay. Education is at all three levels. Okay. Think about it. At the primary level, education, we're educating to try and prevent something before anything ever occurs, right? We're trying to prevent something. So we're educating about that. Secondary, we're still educating because we now have identified through screening a high risk group for whatever, diabetes, obesity, substance abuse, drug abuse, whatever. Okay. So then we're still educating, right? Because we want to try and stop the process before it actually, they may be at risk for obesity, but if we can step in and do some education on healthy living, healthy diet, healthy exercise, we might be able to reverse that course. Okay, so we're educating the secondary. And then tertiary, we're also educating. They have a disease or a condition or a something. So we're educating them on how to treat, manage, improve their quality of life. And the only reason why I explain this in such detail is because a lot of students get tripped up thinking education is only at the primary level. Okay, it's at all three levels. All right, make sense? Questions about that? I'm skipping through here. Healthy People 2030. Has anybody had the chance to go on their website? Pretty big website. Lots of things covered. Okay. These are objectives. I don't know what you took from it, but what Healthy People 2030 is national objectives to improve the health and well-being over the next decade. And it applies to everybody. So if you look at the website, they have all these different sections. What are some national objectives for kids, babies, pregnancy, elderly? Okay, these are very broad, very ambitious goals. Okay, Healthy People 2030 Healthy People started out, I think, at 2000. So now we're on our fourth decade. We started out with Healthy People 2000, then we went to Healthy People 2010, 2020, and the last year we're transitioning into 2030. Okay. So have a look at these 5 bullet points. Okay. These are the 5 bullet points that are, if you get asked a question about what are the overarching goals to Healthy People 2030. Okay. Here's your 5 goals. Okay. So I'd highlight that. Okay. I'm going to highlight that for you guys. Okay. We do need to know that. Okay. So these would be Healthy People 2030 overarching goals. Okay. And since the Healthy People program is directing or facilitating the way we do public health, the way we do community health, it's important to know what their overarching goals are. I mean, look, we'll read a couple. Attain healthy, thriving lives and well-being, free of preventable diseases, disability, injury, and premature death. Does that sound like a ambitious goal? Yeah, this is for the health of the country. Eliminate health disparities, achieve health equity, attain health literacy to improve the health and well-being of all. Those are some big issues. Disparities, inequities, literacy, right? Create social, physical, and economic environments that promote attaining the full potential for health and well-being for all. Notice how all of these say for all. That's the goal. Yeah, they're ambitious goals, they're broad goals, but we're already practicing some of these. That's the whole purpose of these. These are our guidelines. Promote healthy development, healthy behaviors, and well-being across the lifespan. Great goal. Okay. Another key term when we talk about community health is social determinants of health. Okay. Need to know about this. What do you guys think social determinants of health are? What determines our environment? Where we're born, where we live, how we've learned, what our education is, where we work, what are our hobbies? Do we have a specific place of worship? All those social determinants, okay? They will affect health, functioning, and quality of life, right? And then here, social determinants of health are grouped into 5 domains. That's what we need to know. Okay. And this is standard throughout all of public health. Economic stability, education access, healthcare access, neighborhood or environment that you're in, and how are you socially connected to the community? These all make a huge difference. Okay. So if you're asked about, so what is a social determinant of health, or how are they grouped? Okay. And this will look different in every community, right? There may be some communities that are economically stable, some that are not. There may be education access to any school you want to go to, may be prevalent in one community, but not prevalent in other communities. Same with healthcare access. Do you have insurance? Are you underinsured? Do you have no insurance? Do you have public health insurance? What does that do to your access and your quality? and the neighborhood you live in. Do you live in a safe neighborhood? Do you live in a neighborhood that has a lot of violence? And then how well are you connected into the community? Are you part of book groups or kids play sports or religious affiliations? Are you connected in or are you isolated? Think about that. These determinants, these 5 social determinants, play a huge impact. And I can tell you in public health, we consider one of the most important indicators of the healthy functioning of a family is economic stability. That just is key across the board. So remember that. Economic stability drives everything. If you're economically stable, you have access to the things you want. If you live in poverty or don't have an economically stable environment, think of all the things that are affected. Healthcare, school, basic needs. Okay, so the economic stability is what really drives the health of the community, the family, the individual. And I think we probably talked about, no, we didn't. I maybe talked about this in my little recording, but remember, in public health and community nursing, very different from the hospital setting, from where you work now, what your clinical assignments are, when to get to the hospital or whatever. In the community, you can have your client can be one of 4 things. One of 4 categories. It could be an individual, right? It could be a family. It could be, say, a subset of the community, say the homeless or the addicted or the elderly or high school kids. I don't know. It could be a group, a subset within the community, or it could be the whole community. Right? Just because we work in community health doesn't mean we're just going to be dealing with one patient after the other. We may have whole families we're dealing with, right? Okay. Okay, I just kind of already said this, but social determinants of health have a major impact on people's health, well-being, and quality of life. We talked about some of these: safe housing, transportation, neighborhoods, racism, discrimination, and violence, education, job opportunities, income, and so on. Okay. Oh boy, what did I just do there? Did I just, what did I do, you guys?
You can just undo it.
Where?
Top.
Here?
Control Z.
What?
If you hit Control Z, it'll undo whatever you just did.
Awesome. Oh my God, you guys are so smart. I'm just a old lady nurse that has very technically challenged. We talked about social determinants of health contribute to the health disparities and inequities. Vulnerable populations. What are some examples of vulnerable populations in your communities?
Homeless,
Homeless,
pregnant teens, veterans, elderly, people with STDs like HIV.
Mhm. What about mental health?
Chronically ill.
Chronically ill, that's a big one. That's a huge one in community health, huge. And then the addicted and substance abuse, addictions and substance
Poverty.
abuse, poverty, living in poverty. Mhm. And then in community nursing, we refer to children as our most vulnerable population. Why? Because they have they're unable to advocate for themselves and their own interests. Okay, protect themselves from harm. Okay. Elderly, you can read through this. We've already talked about this, but elderly is vulnerable, chronically ill. What about the American non-English speakers? Right?
Because they're not aware of the resources.
There may be such a language barrier that they, number one, don't understand healthcare instructions.
Most of them are afraid also.
Exactly. Exactly. And I know it came up earlier, but another big issue in community health is we call it health literacy versus health illiteracy. Think about it. And think about all the different cultures in community nursing. Well, actually, wherever you work, right now, we have such a diverse world, diverse cultures. We're
Being
gonna be
able to
working-
trust.
What
Yeah.
they believe in also.
Right?
Because most of them, if they come from like out the country,
Mhm.
most of them rely on like herbs or alternative medicine instead of just going to the hospital and seek care.
Mhm. Absolutely. One of the things that we talk about with vulnerable populations that is so important to try and build is resilience. Okay, the definition of resilience, you're going to be asked about this. The definition of resilience is the ability to resist or succumb to health risks. So the more resilience you have, the less likely you're going to succumb to health risks. Right? And these two bullets here talk about resiliency. Resiliency is influenced by early life experiences, right? So for example, negative events or in childhood that aren't dealt with through counseling or other approaches can decrease resiliency, right? Resiliency is all about increased confidence. Okay.
Will child abuse be an example of this? Like that negative that makes them
Yeah.
less.
And if it's not dealt with through whatever, counseling, whatever, and that's carried through life, then your ability to be resilient is more at risk. Okay, then poverty. Talk about poverty. Poverty is a primary cause of vulnerability. And it's a hugely ongoing growing problem in the US. Okay. Education plays a role. Right? Higher education. Education leads to better choices. Right? Education may also influence your perception of stressors and the effects of stress. Okay. Veterans, we talked about being vulnerable. And it goes through the section on veterans. Okay, so that's your introduction to vulnerable populations. But remember, in your modules, let me go out here. In your modules, don't forget. Okay, in your modules, you have your readings, right? You have your book readings, right? So you have your fundamentals, chapter 1, Med-Surg book, but then you also have, don't forget your Canvas readings. And that's what we just went through. That was the summary of your notes, your introduction to community nursing, levels, prevention, healthy people, 2030, and introduction to vulnerability. So did you all see those in the module? Yep. Okay. Let's jump into week 2. First of all, does anybody have any questions on week 1 material? That's just a summary. So again, we're now in week 2, and here's your book reading. Okay, we're talking, and this you've probably figured out that these are common childhood ailments, right? And that's what your discussion question is, right? And when you go to read, you're just responsible for reading these pages, not the whole chapter. Okay, so you have quite a bit of book reading for this particular week. And then you have 2 module readings. You have a page on school nursing and a page on lead exposure. Does everybody understand where to find these Canvas readings? Right in your module. Okay. So this week we're covering school nurse, growth and development, common childhood ailments, family nursing, and family health risks. And that's what all this is about. Okay, so let's go to our week 2 notes. And actually I think it's great for you guys to have weekly notes because it's a summary of everything we're covering. Okay, so school nurse. I can tell you back when I was in school a long time ago, like young kid, people went to the nurse's office for what? Band-Aids and hugs, right? What do you think school nurses do now?
A lot more.
Like,
Medications.
Mhm.
They can act as like listeners, because I mean, maybe they are feeling sick because they got problems at home and it's reflecting on their health.
Mhm. Let me
And
tell you some of the
education, especially for like the
education,
things
big,
like that.
huge education. Let me tell you about some of the things that I did in my last 5 years of school nursing. I was catheterizing female and male students. I was doing trach care. I was replacing a trach temporarily if it came out. I was doing G-tube feedings. I was replacing a G button if it came out. I was giving medications. I was giving insulin. I was showing kids how to use their pumps and double checking pumps and giving insulin shots. I was giving emergency medication for seizures. Okay, I was giving glucagon for bottomed out blood sugars. And remember, education is inclusive now. So everybody is in school. Everybody with every level of disability is in school. Physical, emotional. So school nursing has come a long way. Okay, we perform many, many, many functions. Okay, we sometimes, I just gave you examples of being a direct caregiver. I think Kadisha mentioned health educator. Yes, that was a huge part of my role as a school nurse, educating kids on how to use their inhalers, educating kids who were new diabetics, working with the family, trying to integrate the kid into school with the diabetes diagnosis and making he or she feel comfortable. Right. And knowing that, assuring the parents that they would be cared for safely. Also a consultant. Right. I always did. I mean, the school nurse is kind of the go-to, especially with COVID. Right. Everybody comes to you. Everybody comes to you. You're the one with all the answers. All right. Providing teachers with information, school administrators, right. Doing health education with the staff, case manager. We'll learn about case management a little bit later, but basically nursing. Do you guys know what a nursing case manager is? What's a case manager? Case manager, the simple terms are coordinator. You're the coordinator of care. That's what a case manager does. Okay, so yes, I was considered a school nurse, but I also, one of my roles was a case manager for the very complex kids. All right, very complex chronic illnesses. So I coordinated some of my most medically fragile kids. I coordinated with the special ed team, physical therapy, occupational therapy, speech therapy. I became the case manager, making sure that their IEP, their individual education plan, was all followed. Okay. And then certainly some community outreach. We participated, we did vaccination clinics, we participated in health fairs, did blood pressure screenings, blood glucose screenings, obesity screenings.
Scoliosis.
Oh, I brought speakers into the schools to speak with teachers. I brought parents into the school to speak about new diagnoses with their children, with the teacher and I, or the SPED team if they were part of special education. So school nursing is an extremely important role in the health and well-being of children, not just during the school hours, but even before or after. I worked with a lot of parents over many, many years, whether they were allergy, asthma, diabetes, seizures. Okay. One of the things that we talked about earlier, and this is at school, but what are some primary, secondary, and tertiary interventions? Okay, so you can read through this. Primary, preventing before it even occurs. We talked a little while ago about seat belts, helmets, playground safety, prevention of sports-related injuries. Okay, so this gives you a nice little summary of how does primary, secondary, and tertiary look like in the school nurse setting. Okay, so remember I told you you have to be able to apply all three of these intervention levels to different topics we're talking about. So this is a beautiful summary of lots of examples of primary, secondary, and tertiary with regards to school nursing. Okay, so I want you to have a look at that. Remember, secondary, screening, early identification, early treatment. Okay. And then tertiary. Tertiary, let's say they have ADHD. A tertiary prevention is giving medication, right? They already have a diagnosis. Okay. So I want you to have a look at that. Family development. Okay. Here's an interesting question I always ask. What's the definition of a family these days? Whatever they say it is, right? Who are you to question a family structure or family function, right? What is a family? Whatever they say it is. Family, the simple definition is family are the people who provide physical, emotional, and financial support. And we definitely know that non-traditional families are the norm, right? So a family is whatever they say it is. Whoever's supporting, who's overseeing the family, who's responsible for physical, emotional, financial support of the family. Okay, so in every family, there's 5 functions. It looks different in every single family, but these are 5 functions when we try and determine if a family is healthy or unhealthy. Okay? And here's the 5 right here, 5 functions of a family. So you do need to know this. Okay. And again, these are the basic functions. It's going to look different in every family: financial, health, reproductive, socialization, and affective. Right? So let's talk about a healthy family. Financial function: planning for the future, making good financial decisions, providing housing and insurance. Health: teaching healthy behaviors, teaching health maintenance, providing informal caregiving, right? So taking care of your family. Reproductive: what does that look like? It says here perpetuation of the species, but do we have a lot of kids? Are we able to care for those kids? Socialization: do you raise your children to fit into society, to become productive, responsible, well-adjusted adults? Are we passing on our spiritual, religious, cultural beliefs? And then lastly, affective: creating a sense of identity and belonging through affection, love, time together, bonding activities. Okay, so those are your 5 functions of a family. Healthy, assuming you're doing all that. And then, of course, failure to meet these functions leads to dysfunction and crises, right? May lead to substance abuse, anxiety, depression, work issues, unsafe sexual practices. Okay? These are some of the indicators of a dysfunctional family. So you can call it a functioning family, dysfunctional family, a healthy family, unhealthy family. Those are all used interchangeably. Right? We know the family is our first and most important safety net and social support system. Okay. You can go through and read chapter 18.1. It's not mandatory, but you can. Interesting. It's interesting. So, okay, so let's talk about family health risks. Okay. As far as family health risks, there may be genetic risks that come down from one generation to the next. There may be environmental risks, lifestyle behavior risks. And when we're caring for families in the community, we have to consider all 3 of these. So some genetic risks, right? We know we're all born with certain predispositions. Okay. Family history. Okay, family history is always important. And that's what we'll talk about genograms later, but let's say somebody in your family dies of prostate cancer, but you have no history of prostate cancer in your family. Or maybe you do. That's where you do the genetic, go back 3 generations and find out who had what, who died of what. Okay, so that could, family health risk can come from genetics. Environmental family health risks. Okay, what's the physical environment you live in, social environment, political environment? Do you live in a high crime neighborhood? A lot of pollution, living conditions. Are they adequate? High stress environments. Does discrimination happen based on race, social status, religion, immigration status, ethnicity? Right? Lack of adequate financial resources, social resources, emotional resources all lead to higher risks, right? That if not dealt with will eventually lead to crises. And then the last type of family health risk is behavioral. What's our diet? Okay, do we eat high sodium, high saturated fat diets, high sugar. All this contributes heavily to chronic inflammatory conditions, diabetes, hypertension, CHF, osteoporosis. Okay. Kids who grow up seeing healthy behavioral patterns, right, have a much higher risk of, no, I'm sorry, a much higher, if kids are growing up in environments with healthy eating, healthy exercise, healthy communication, right? Hopefully they will grow up engaging in these same behaviors later on. Limiting alcohol, avoiding tobacco, violence and abuse within the family. Right? Violence and abuse is a really strong risk factor for future violence, abuse, substance abuse, mental health. Okay. We know that the concern here is obesity. The rates of obesity in kids have been rising steadily for a variety of reasons. Okay, not just diet and exercise, but also environmental exposures to chemicals and pollution. I mean, think about where you live. Think about the environment that you live in now. What are your environmental risks? Is it a crowded community? Is it an unsafe community? Do you live near an industrial? Do you live in an industrial community? Do you live in a rural community with farming? Do you live near an airport or a major transportation hub? Do you live near a waste site? Okay, those are all the things that we think about in community nursing. We know that injuries and accidents are very common and very preventable with kids. Some of the most common injuries and accidents come from falls, fires, drowning, suffocation, poisonings, accidental poisonings, sports accidents. Okay. And then the last part of this is, the last part of your notes is common childhood ailments. You're going to get asked a few questions on exam 1 about all these ailments. Okay, just giving you a heads up. Okay. I know you know about asthma from Med-Surg, right? Okay. Same with eczema, type 1 diabetes, conjunctivitis, scabies, lice, ADHD, iron deficiency anemia, scoliosis, and lead exposure. So I know you've been introduced to those. And I think I told you last week that I think I told you last week that we talked about why this class is at the end, right? The end of your program. Well, the class is at the end of your program because you're now bringing all this together. All those common childhood ailments, where did you hear about them? You've heard of every one of them. Where have you heard about them? Peds, common childhood ailments.
Peds, maternity, Med-Surg, mostly
Farm.
all the classes.
Exactly. Letting somebody else in here. So that's your week 1 and week 2 content. What do you think? Makes sense? starting to broaden your thinking of community? What all goes on in the
It
community?
does. It does really make sense. But when I thought I was comprehending and getting everything, like the questions that they ask are kind of like tricky, you know?
On what, the quiz?
Yes.
Oh, okay,
Yes.
okay. Well, pull up your quizzes. Let's go through the quiz. Has everybody submitted the quiz? Let's spend the last. Pardon
Not
me?
able to, we're not, well, I am not able to see it again. It's gone.
It says the answers are hidden, like
Yeah.
hidden.
No, we can't see it again.
Oh, well, it shouldn't be that way.
It's just gone.
So you don't know how you did?
Yeah,
We know how we did, but we don't know what we got
but
wrong.
we can't see it again.
Okay, well, as we go through the questions, hopefully you can pick out which ones you got wrong, right?
Miss Marvel.
Yeah.
Yeah, so and the quiz was based off of what material from the first week?
It was a combination of week 1 and week 2.
None of
So
it.
the information we just went over it today. Yeah, I was gonna say because I really don't
None of
I
it.
really don't really remember too much. Hold on just a second. I'm sorry.
But did you guys listen to my recording from last week?
I was actually in class last week, but it's just
And
like
we-
the only thing I really remember is you going mainly over the PowerPoint. So it's like taking
That's
this quiz. I don't really remember anything far as what was on that quiz. I don't remember going over any of them chapters besides what you just went over just now.
Right, but I also sent a recording of a summary of what I just talked about. Did you watch that?
Yeah,
couldn't-
week 2, but not week 1.
I couldn't find a recording at all for week
Me
one.
It was the orientation actually that you
Mhm.
sent out.
Yeah, the only
Yeah, you
recording
sent
that
the
I saw was just
orientation.
orientation again.
Okay.
Yeah, it was only the orientation one.
Well, did you do your readings from
Yeah.
last week?
Absolutely.
I did, yeah.
Readings, all the readings, the notes, everything,
Okay. Okay.
repetitively.
Okay. Okay. Hang on one second. I just want to look at something. One sec. Yeah, in your I'm just looking course concept recording. In your announcement with week 1 attachments, announcements, whatever, if you scroll to the bottom, the very first link is to concepts recording. Do you guys see that? Yes, no, I just saw
Are
it
you
in my,
talking about the orientation PowerPoint week 1 or like which one you talking about on here?
so,
With the announcement and everything.
so one of the
that's
things I
course
mentioned
concept.
last week was orientation. So I had to cover the PowerPoint. In the meantime, I sent in my week 1 announcement, attachment, information. That's the header. If you look at the bottom, the very first was concept recording. You see that?
Oh yeah, I see it.
Yeah.
And underneath there's like the the link
HESI
to
prep.
download the PowerPoints and the HESI
Yep.
prep and all that.
And week 1 notes. So the concept recording was what I just went through in the first part of class. And then when I just sent you the week 2 over the weekend, it also had another video attached that said concept recording for week 2. And that was what I just covered in the second part of class, along with the week 2 notes. right? Everybody seeing that? It's always important to scroll down to the bottom because that's where I
I
put
guess it
all
was
my,
just misleading.
I'm sorry? What now?
Something else.
Um, the other thing I want to point out from week one, and I'll just
Sorry.
repeat. Oh, the other thing I want to point out from week one is that HESI prep assignment. You guys see that in the week one announcement? What did I tell you from last week? Let's make sure we have this right. What did I tell you from last week about the HESI prep assignment? Which one do you
That is
use?
the one in week 1 and not in the one in week 9.
Exactly. So I would highly suggest that you take that, print that HESI prep out from week 1. Don't use week 9. I mean, you can, but it's going to be probably another 25% of information to cover that's not on the HESI. Okay. I tried to have that removed from curriculum, but it didn't get removed in time. Okay. So that's why I'm telling you ahead of time. Your week 1 HESI prep is the one you should be using. You know, I don't want you to forget about it. Okay, so let me go in. This is what I'd like to do. Where's my HESI prep? So this is what it looks like if you haven't printed it out. Okay, the big difference is I've added some specific directions to make it easy for you. So what I'm looking for is thinking about ADPI, thinking about nursing process with all of these nursing guidelines. Okay, so I have gone through the last 3 terms of HESIs and come up with the topics that they were asking about based on the actual questions. Okay, so I have gone through and summarized for you and broken it out into categories. So this is so there is a question on the HESI about anthrax incubation. There is a question on the HESI about smallpox. There's a question on the HESI about Ebola, sarin. I don't know what the questions are. I'm not privy to those, but I am privy to what it's asked about. So as we go through the term, what I'm hoping is that you fill this out after every class. And I do try my hardest to remember to pull this up every class to see what we've covered and what you can fill in. So for example, let's see what we've covered here. Okay, here's your childhood ailments. You can fill that out. Okay. School-age child. This is in your readings, teaching, health screenings, adolescents. Okay. I mean, it's not going to be word for word or it's just not, but these are the topics they're covering. So we're trying to cover these in class. Okay. We'll get to occupational health, environmental health. I think next week we cover home health, hospice and palliative care, respite care. Okay. So we're going to hear vulnerable populations. I think we talk about that next week too. So as we go, I guess my point is you are turning this in week 9. Completed. All these boxes have to have something in there. Okay. It's much easier if you just take a peek at this after each week and fill in what we covered. Does that make sense? Versus doing it in week 8. It's going to take you forever to go back and say, oh, what week did we cover that in? Okay. That's why I introduced this in week 1. Print out the correct version, which I gave you in week 1, and then just start filling it out. So by the time we get to week 9, it's completed and you just submit it. Make sense? Yes, no?
Yes.
Okay.
So Miss Margot,
Mm-hmm.
we're gonna go over the quiz, right?
Yeah, we're gonna do that right now.
So the quiz for week 3 is over weeks 1, 2, and 3.
Yeah, it's
'Cause we have a
cumulative.
quiz
Yeah,
next-
it's cumulative, but you know, it does focus on the week at hand. So most of the questions
Yeah,
on
I
this,
thought that.
yeah, most of the questions on this first quiz were on this week. You know, it's a combination of last
this
week and
week
this
too.
week. What?
I usually thought that we quiz over everything that we learned the following week. You know,
Yeah.
like if we have a quiz week 2, it's over all the material for week 1. I didn't know to include week 2 as well,
Yeah,
but now that I know.
I put that in the announcement that well, the expectation is that you come prepared to class.
Absolutely. And that's what I was doing, reading my week 1
Mhm.
material, but I looked over my week 2, but that wasn't till Saturday or Sunday. You know what I'm
Mhm.
saying? Like,
Yeah,
so
yeah.
yes, to be clear, next week's test is over 1, 2, and 3.
Yeah, this whole class, Kadisha?
Mhm.
Did I say it right?
It's Kadisha. However
Kadisha.
you want to say it,
No,
whatever.
no, that's not right. I want to say it correctly, Kadisha.
I don't
This
know.
class is cumulative anyway, right?
Okay. Yes.
Think about it.
Did
This
you say a
class,
test is next class? Sorry for interrupting.
pardon me?
Did you say there is a test next class?
No, I said we have a quiz next week.
Oh, okay.
Mhm.
Another quiz. Our first test is until week 4.
Will
Right?
this quiz be on the material we just went over today?
In week 3, week 1, 2, and 3.
Yeah, just keep it going. It's cumulative. That this whole class is cumulative. We're taking all the information we've learned over the course of your last 7 terms, right? And
Is
you're gonna
there
see
any-
you're gonna see
is
in
there
the
any- Go ahead.
you're gonna see in the exams, the community exams are very med-surg focused. Because what are we doing in the community? Right? We need our med-surg skills in the community. We need our pediatric skills in the community. We need our geriatric skills in the community, right?
I just think that the confusion lies in that everybody was prepared that this was going to be like the classes where when we only test on the material that we've already gone over, not on the material that we haven't covered in a class yet. So I think that's where the confusion was for all of us. Because
Yeah,
we're just used to, like, if the test was today, it wouldn't have any week 2 material in it because we're going over week 2 today. So I think that's where everybody got confused. Because we've
Right.
never been in a class
So-
setup where we have to test on material we haven't gone over yet.
Thank you for that, Rachel, because I was about to ask her because I was just in a maternity class. And I like doing the quiz at the end of the class because my instructor, the quiz had material on it that she was talking about on the day of. And we didn't do so well on the quizzes. So we were studying like week 1, but
Mhm.
then she had what she was lecturing on that we hadn't even heard. And we was taking the test at the beginning of the class. And
Mhm.
that was like difficult.
So if you go back to the orientation PowerPoint from last week, there was a whole slide on quizzes. You guys remember what it said? Christina, what did it say?
It said that quizzes are at the beginning of the class, and they're meant for you to prepare, like do your readings from week 1, week 2. It's meant to make sure you did your reading materials.
Make sure you come to class prepared. We went over that last week. That was a slide.
Absolutely, but you can come to class prepared, reading that week 1, thinking that the test is the week 1 or it's week 2, sorry, is over week 1 or whatever. So we're going over week 1 repetitively so we can have all that information. And then with us having different classes, we're starting our different chapters some people start on Friday or Saturday or Sunday or whatever, and this class is Monday. So I could have went over that material on Saturday or whatever, but it's not as clear as week one's material would be in my head, if that makes any sense.
Yeah, it makes sense. It does.
And then also some of us have a class in the morning on Monday, and then we're waiting until 3 o'clock for another class. So if you've already studied, you're waiting, some that the information is not fresh. Cause you're
Professor,
also taking a quiz, like today, we had a class and it was a quiz and stuff too. So, I mean, to me, that's happened like 2 terms, and I feel like that just sets you up for failure. It's too much.
Is
And
it
I'm
possible we
taking
can do
this
the quizzes
class.
at the end of the class?
I'm sorry.
Is it possible for us to do the quizzes at the end of the class versus like as soon as we get into class?
I mean, I went through it in the orientation PowerPoint last week. The quizzes are to be given at the beginning of class. The
Yeah, 'cause
expectation is that you're preparing for class.
Yeah, we are preparing. I know I prepared for class because I'm a restart. Failure is not an option for me. You know what I'm saying? But and then on the syllabus, it usually says like for the exam, it says this exam is going to cover a week, so and so. But for the quizzes in our syllabus, it didn't even tell us the weeks that it was going to cover.
Okay. Well,
Is it up to the teacher to give the quiz at the beginning of the start of the class? Because we took a
no, it's not
bullet-
actually, Timu. It's the policy. That's why it was on the orientation PowerPoint that, and actually if you're taking med surg and peds, you went through the PowerPoint 3 times, right?
I'm not
Yes,
taking
sir.
med surg.
Okay.
I'm not doing med surg this semester. They
Okay.
had to.
Are you taking
move my-
peds?
I'm taking P's, but what the teacher just did, we just took a quiz today, and what she did was actually went over the material, and we also did a Kahoot, took the quiz.
And it was very good.
Okay. Okay.
Sorry, I didn't mean to start like a whole thing over it.
No,
I was
it's
just
okay.
pointing
It's
out like the
Okay,
difference,
and I
like, in our
appreciate all the
PEDS class.
feedback.
When
And-
in our PEDS class, the reason it was confusing is because our PEDS class, our week 1 test was just over week 1 material. So that's the way that all of the other
You
classes
mean
have
your
been
week 1
structured.
quiz?
Yeah, sorry.
Yes.
Our week
I
1
was
quiz
gonna
was
say
only
that.
over week 1 material, which is the way it's been structured in PEDS and in all the other classes. So I think just coming into this, we just kind of assumed that
Okay.
this was going to be structured the same. And so it was just a little bit confusing to have. I know that you had said it. And it makes
Okay,
sense
so let me
now,
ask a
but I
question.
think
What do you
kind
guys
of
think it means on the quiz slide, on the quiz PowerPoint slide? Christina, can you read me that again, please?
I just think, I'm sorry.
Hang
I
on.
Hold
hang
on, let me pull it up. I wasn't actually reading. I was just kind of going from memory there.
Mm-hmm.
It makes sense. I think that it just kind of got glossed over, and there was just probably a large assumption that this was about how it was going to be structured. So I mean, when you said it, yeah, it makes sense. And you did say that, but I think it just kind of
Okay,
automated into what
so once
would have been the standard of.
Yep,
That's all.
I appreciate that, Rachel. Thank you. So the purpose of giving the quizzes at the beginning of the class is exactly what the slide says, and it should be standard in all the classes. That the quizzes are given at the beginning of the class to, not to check, that's the wrong word, but to just get you guys into the habit of preparing for class ahead of time. I mean, it's as simple as that. And if there are other instructors that do their quizzes at the end of the class, that's an issue. That's not what's supposed to be happening.
They do it at the beginning. It's just the content on it is different. That's all.
Okay. I'll take a look at that. Thank you.
Gonna
I'm gonna go over the, may I please go over the quiz since is that okay to go over the quiz? Okay. Okay. Question 1. What is an example of community-based nursing? What'd you guys answer?
Education.
Okay. Everybody understand why that's community-based? We're working in the community. So this would be a school nurse.
Education.
This would be a school nurse, right? They're based in the community, working in a school, teaching a kid how to use an inhaler. Right? Number 2. This is from week 1, which describes the purpose of Healthy People 2030.
A.
Okay. Everybody understand that? Why that's A. And actually, this is from week 1 as well. Question
The
1 is
first and
from,
second was, yep.
pardon me?
The first and second question was from week 1, correct, yes.
The question 1 and question 2 are from week 1, right?
Mhm.
Okay. Question 3. Which is true regarding uninsured versus underinsured individuals?
They're more likely to be diagnosed with advanced disease
Why?
because they don't seek preventative care because the lack of insurance, or maybe they're too worried about how much it's going to cost them.
Right. Did anybody get that wrong?
We can't see it.
Well, I mean, you should be able to know what answers you chose, right?
I guess.
Okay. Question 4. Okay, this is a week 1 question. Introduction to vulnerability. That should be, this was in your Canvas reading from week 1. Okay, so who's vulnerable?
Better and
Yep.
substance abuser,
Yep,
HIV.
yep. That's right from your week 1 reading.
I do got a question.
You
I
bet.
didn't pick it, but I was kind of thinking about picking it, the vaginal candidate, the 23-year-old with the
Mhm.
vaginal candidiasis.
Right?
Well, I know that it's not a vulnerable population, but could it be considered a vulnerable population if
No.
left untreated, of course?
Oh, if left untreated, possibly, yes, but that's not what it says.
Okay.
Yeah. Okay, question 5. This was in your week 2 notes. I mean, what you guys know what resiliency is. Let's assume you hadn't read your week 2 notes. What happens? The more resiliency you have, what?
It reduces the risk of.
The-
Go ahead. Sorry.
Sorry.
Oh, go ahead.
Reduces our vulnerability to
Right.
wait, no. Yeah.
Right. But look at the other 3 answers. Resiliency increases the likelihood that somebody will get sick. That's just the opposite. Right? Resiliency depends solely on genetic predisposition. That's not true. Resiliency cannot be learned if a client does not possess it. That's not true. There's only one answer that even makes sense. Right? Question 6. Which
No, I thought it was
I put the 7-year-old, but I'm
Me
not sure if that's correct. Because I was following the ABCs, and obviously the rash can lead to, because if left untreated, you don't know why the rash is happening.
I put the 9-year-old.
9-year-old's a correct answer. Why?
Because they're coughing, and sneezing,
Breathing.
Breathing.
asthma.
Right, this is, what is this? I mean, forget that common childhood ailments are in your second week. Just think about pediatrics. Okay, what's this? What could this potentially be a sign of?
Asthma.
An impending asthma attack. Right? Okay, iron deficiency anemia. What do you guys, you've learned about iron deficiency anemia before this class, before this week? What do you know? What food is recommended?
Eggs.
Yeah, you guys should know that from peds, right?
Nutrition.
Nutrition, right? Or nutrition, right. Nutrition class, pediatric class. Okay.
So the answer is eggs, right?
Oh, yes, sorry. Eggs, yeah, A, yep. Okay, question 8. Can anybody pronounce what this might be?
I said advise parents to obtain full medical evaluation.
Why? What are dark discoloration along the neck crease and in the armpits? What is that a potential sign
I
of?
said eczema.
Diabetes.
Insulin resistance.
Say that again?
Insulin
Diabetes.
resistance.
What is it?
Eczema.
No, this is a potential sign or symptom of diabetes, pre-diabetes.
I said diabetes.
Ankylosing Nargrenth. Okay, that's what that is. That's what that's called. Did you learn about that in peds?
We just started
Oh, it's
peds.
med surge.
I haven't
Or I
even
mean
took-
med-surg, yeah. That's a pretty common sign of pre-diabetes. So the correct answer is advise parents to obtain a full medical evaluation. I mean, why would you evaluate, and I'm just talking out loud here, why would you evaluate the scalp? Has nothing to do with the question. Remind child to use cream in the areas. That's kind of not up to us. That's kind of not up to us to tell the child to use cream. We don't even know what it is yet. Right? And then recommend an iron-rich diet be initiated based on what? I mean, that's why you do think of your nursing process. Assessment. This kid needs an assessment. This kid needs an evaluation.
Professor Marvel, sorry to interrupt, but normally isn't this class given in the end with capstone?
I'm sorry?
This class, don't we normally take this in the end with capstone?
Nope. It's normally
Oh.
taken, this class is normally taken with pediatrics and med-surg.
Capstone, you take
Med-surg too?
leadership and mental health.
Oh, okay.
Capstone, what?
You take capstone, mental health, and leadership.
Leadership, right. That's the last one.
Oh,
Yep.
okay.
Question number 9.
That's possible lead exposure.
Yeah, lead exposure.
Exactly. Right? I mean, one of the things we talked about this week is lead exposure, or that you read about this week is lead exposure. And one of the biggest red flags for lead exposure, potential lead exposure, is developmental delay. Okay. I mean, why would you, if a child is experiencing a developmental delay, why do we immediately have to assess lung sounds and heart sounds? A family history may be important down the road, but it's not
So
Yeah.
family history could be an answer, but at the moment, the first priority is gonna be the evaluation
But
of
what's,
athletic.
yeah, but what's the most important word in that question?
Is the
Priority.
priority.
Priority. Priority. Right? Advise increasing iron intake in the diet. Maybe down the road. Right? But first we have to figure out what's going on. Right? And the first step is evaluating for potential lead exposure. Remember to pick out those important words, and we'll talk about that in exam reviews and test reviews and all that. Okay. What about number 10?
Encourage parents to reduce screen time,
Why?
because this is one of the risks for obesity.
Right. I mean, A is obviously incorrect, right?
Mhm.
Kids in the 90th percentile, why would you advise more snacking? D, recommended 100% fruit juice. Is that healthy? Why would we need to refer for an urgent medical evaluation at this point? Nothing has to be urgent, right? So by process of elimination, you come to see. Excuse me. Just getting over a cold. Sorry about that. Okay. Does anybody have any questions about the quiz? Nope, I'm
I
missing.
do.
Pardon me?
I have a question.
You bet.
Can
Okay,
we have a
Brandy?
makeup quiz?
There is no makeup quiz, no.
Okay.
Okay, so that's all. Let me take a peek. What do we got going for next week? Let me take a peek at this. You guys already know what you have going for next week? Or this? Let's see. This week, I mean. Just the quiz. That's all we have for this week. So you're done with community for this week. All I would do is start to have a look at that HESI prep. Okay, that's what I would have you guys do this week. See what you can fill out. Week by week, get that thing filled in. Okay,
Miss
question.
Marvel.
Yes.
Yes, when so what will the quiz next week be on? What weeks for it'll be over week the material we just went over, which is week 1 and week 2
1, 2, 3.
And 3.
and 3 as well. Okay, so week 3 we just have to read ahead then before we come to class.
Correct. Preparing for class.
I got you. Thank you.
You're welcome. Well, it's good to see everybody this week. We're done with 2 weeks of lecture. I'll send the recording. And if you have any questions, I'm going to stop the recording, but if you have any questions, I'll stay on after. Remember to let me know if you are repeating, if you have accommodations, or if you're a reentry student. Okay. And then reach out to me if you need anything. You know where to find me.
I have another question.
Sure. Go ahead, Brandy. It's okay.
Well, since we can't have a makeup quiz, can we complete a survey to like replace a quiz, the lowest quiz grade?
There's nothing. There's nothing. I mean, again, I went through this. I went through this in orientation, and I went through this in the announcement. I get what
Okay.
Rachel is saying, and I'm going to be more mindful. But I mean, the questions that were from this week were pretty basic questions. Right? They just were. No, you don't agree, Brandy? I mean, if you the lead poisoning question, that was in your readings, right? The expectation is that you're doing your readings before coming to class.
Yeah,
so-
that's true.
That's the expectation. That's what it says on the slide in the PowerPoint, that Christina was going to read me. She never did. But that's okay. It says for preparation for class, that's the expectation. So I just don't have, I told you last week, there are certain things I have flexibility on, certain things I don't. The expectation for faculty is that we give the quizzes at the beginning of class. So,
Okay, thank you. I just wanted to ask.
no, I
It don't
appreciate
hurt
the
to ask.
question. I appreciate the question, Brandy.
All right.
All right, I'm all done. So if you guys want, you're more than welcome to log off. If you would like to stay and ask questions, feel free to or have a good week. Have a good rest of the week.
Have a good weekend.
Thank
Thank
you.
you.
Thank you. Thank you.